Hey, my name's Chris. Today I want to talk about the RECIST criteria, which is the response evaluation criteria for solid tumors. This is an FDA-approved way of assessing efficacy for different therapies, and we also use this to assess how our patients are doing on their specific regimens. So the way it works is that patients, before they start their treatment, are going to get a baseline CT. That CT is going to find all the lesions throughout the body for the most part, and then what they're going to do is they're going to count up the longest diameters of the 5 biggest lesions. The caveat is, though, that there can be no more than 2 lesions within the same organ. And the way that they can measure those is that lesion at least has to be 10 millimeters in size if it's in a specific organ, or 15 millimeters in the short axis if it's specifically in a lymph node. And then, so they're going to get that baseline CT, get that score of the sum, and then they're going to compare that to any future CTs after they've started treatment. When they look at those CTs, they compare the value of the sum of longest diameters, and they're going to see kind of how those compare. So there can be a complete response, which means no disease is left, a partial response, which means it's 30% down from what the baseline CT was showing, stable disease, or progressive disease. And progressive disease is when there's a 20% increase in the nadir from what the lowest score was for all of their treatment course. You can also have progressive disease if there are non-measurable lesions that can be qualified on the CT scan, or if there's just a new discrete lesion in general that would be measured. Here's a diagram kind of showing how we look at those as well, because we also use RECIST criteria to look and score the patients on different primary or secondary endpoints. So a couple of common ones you're going to see in papers are overall survival, progression-free survival, time to recurrence. You're also going to have disease-free survival, as well as duration of response. So those are a little different. So we're going to start with PFS and time to recurrence. So those are very similar, but they are going to start at time of treatment initiation, and they're going to continue until the patients have progressive disease. PFS is going to include patients that have died, whereas time to recurrence is actually not going to include those that died. Duration of response is also different, though, than PFS, because duration is actually the time point starts from when the patient had either a CR or a PR. The last one is called the DFS, which is the disease-free survival. And this is similar to PFS, also has the same time point starting, which is when treatment was initiated. But the way I understand it is that for PFS, this is for treatments that were supposed to reduce the size of the tumors, whereas disease-free survival was supposed to be used in treatments that were intended to be curative in nature. The last thing that you're going to see trials report is going to be an ORR, which is an objective response rate. And that is looking at the number of patients that either had a partial response or a complete response to therapy. Now, you're going to contrast that ORR to something also called a disease control rate, which is a DCR. And that DCR adds on the complete response, the partial responses, but also the stable diseases. And that's a simple breakdown of RECIST criteria. The more you know.